Hi there. This is a presentation on steroid use in professional athletes, and it is our hope that athletes will be deterred from illegal and unnecessary use of steroids by the end. So what are steroids? Steroids are naturally produced in our bodies in the general form from cholesterol in the adrenal cortex. The two main categories are corticosteroids and androgens. Corticosteroids are further subdivided into different categories. Anabolic and catabolic steroids are different. Catabolic steroids are used for metabolizing glucose, proteins, fat, and carbohydrates and are involved in the immune response to infections. Natural steroids are named hydrocortisone and cortisol, and examples of synthetic or prescription steroids are prednisone and dexamethasone. Another category is mineral corticosteroids, and these are used for balancing salt and water via aldosterone production. Anabolic steroids are the main type of steroids used to enhance performance via muscle hypertrophy. Anabolic steroids mimic testosterone to cause this muscle hypertrophy by allowing the body to recover quickly from stress of exercise on the body. These steroids also increase protein synthesis, which leads to the growth of muscle. Anabolic steroids are also used in medications such as hydrocortisone cream and produced naturally as an adrenal corticosteroid. Since these steroids are mimics of testosterone, they contain androgenic properties that promote development and maintenance of male characteristics. So why do people abuse these steroids? Athletes tend to gain a competitive advantage by improving their physical performance as their bodies increase body mass, strength, and aggression, as well as possibly reducing recovering times between workouts, allowing them to work out more. Non-athletes use these drugs for similar physical reasons to increase their endurance, muscle size, and strength, and reduce their own body fat. These steroids stimulate the androgen receptors in the brain to produce euphoria, but can also lead to increased aggressiveness, which makes the user less receptive to outside opinion and therefore continues to use. There are illegal and legal uses of steroids. Anabolic steroids are used often to treat different disease states. However, these steroids without a prescription are illegal. Other illegal uses include bodybuilding and performance enhancement. Treatment of diseases such as hypogonadism and immunodeficiency syndromes that cause muscle wasting are examples of legal uses of steroids. Examples of these prescriptions are Androgel and Testim. Other legal uses of prescription steroids such as testosterone are hormone replacement therapy for men, induction in male puberty, bone marrow stimulation, appetite stimulation in AIDS and cancer patients, gender dysmorphia, and growth stimulation via replacing the growth hormone.
Steroids can be administered to the user through various means, with the most common form being injection. Other dosage forms include orally taken capsules, topical creams and gels, skin patches, and intramuscular implants. Some of the short-term effects include increased muscle mass, roid rage, which is an aggressive behavior that also occurs with prolonged use, increased blood pressure, increased cholesterol, and the development of acne. A major long-term effect of using steroids is a hormonal imbalance, which can lead to low testosterone levels and erectile dysfunction in men, as well as cardiovascular diseases, liver failure, and possibly death. For men, steroid use can lead to a reduction in testicle size, a lower sperm count, infertility, balding, and an increased risk of prostate cancer, as well as enlargement of the breasts. Steroid use by women can lead to acne, alopecia, or hair loss, such as with a receding hairline, formation of a deeper voice, a growth in facial hair, and a decrease in breast size. Due to these negative health consequences, there are some alternatives that professional athletes can use to maintain a healthy lifestyle and improve their performance. These include eating a well-balanced diet filled with fruits, vegetables, and an adequate amount of protein. Dietary and nutritional supplements can also be taken. The term doping comes from the Dutch word dope, an opium juice used in ancient Greece. Some of the first notable doping cases in contemporary athletic history include the 1904 Olympics with runner Thomas Hicks, the 1967 Tour de France with Tommy Simpson, and the 1983 Olympics Russian doping case. In the early 20th century, running a marathon was seen as the ultimate test of endurance. The coach of Olympic marathon runner Thomas Hicks gave the runner brandy and strychnine, a substance found in rat poison, to stimulate his muscles to get him through to the end. Although Hicks finished second, he was considered the winner because it turned out that the first place runner finished the race by driving across the finish line.
Another case that you may or may not have heard of involved Tommy Simpson, who was a British cyclist known for extensive drug use. His drugs of choice included alcohol along with amphetamines. This drug use eventually led to his death during a Tour de France cycling event. His death helped push stricter rules about drugs and steroid use in sports and sporting events. The International Olympic Committee based the changing of the rules on 3 key principles. The first is that the health of the competitor in the sporting event must be protected. The second is that all sports and medical ethics regarding competition and fair medical use must be upheld. And the third is that all sports competitors must be allowed to compete equally. During the 1983 Olympics, Russian track and field athletes were injected with anabolic steroids under a physician with the excuse that this was necessary in order to keep up with competing athletes from other countries. It goes to show that this can happen to anyone, even professional Olympic athletes. We still see the use of steroids today, especially in professional bodybuilding. There are several popular and legal steroids such as Dianabol and Anvorol. These 2 medications are considered Class 3 controlled medications, meaning that they have a significant risk of abuse. Pro bodybuilders would invest thousands of dollars to compete and invest in steroids and other necessities to do so. Not long before the recent Olympics in South Korea, the International Olympics Committee announced that Russia was banned due to a doping scheme that may have affected multiple events in the past. Many athletes were banned, including their coaches, while 169 who were not banned were able to appeal and compete under a neutral flag. The major aim of professional sports drug testing policies are more to help treat the offender than to punish them, as well as deter other professional athletes from choosing to cheat with steroids. There is no uniform standard across all professional sports. However, each major professional sports league, such as the NFL or NBA, have their own forms of drug testing and treat their cases differently for each sport.